Welcome to Revolution Against Evolution. I'm your host, Doug Sharp.
Co-host Rich Gear here as well, and we have a guest here. We've had you here before, Dr. Gee, and
Dr. John Gee.
John Gee, and it's great to have you back again, talking about nutrition and health, things that I guess I have to learn a little bit about because I'm pretty bad. So
we all do. Thank you for having me.
Yeah, and glad to have you back. It really is.
Yeah, tonight we're going to be letting our doctor friend tell us a little bit about neuropathy, because this is one of the things he's done a seminar on, and he has some ideas that people can have to actually reverse neuropathy, and I think that is something that we can trace back to its origins, how it's a result of damage to the nerves outside the brain and spinal cord, and it's often causes weakness and numbness and pain, and usually in the hands and the feet, and sometimes in the eyes. As for what I understand.
You can get it in the eyes?
Yeah, you've heard of diabetic neuropathy?
Well, I always thought neuropathy was based, a lot of people with diabetes have neuropathy, but usually I figured it was the toes and sometimes the fingers, But
Rich, you got it. We're close. All of those things, and there's also, you can have diabetic neuropathy of the eyes
I
as
did not
well.
know that.
What Doug was just sharing is this is a disease of the nerves, right? So obviously the optic nerve is the cranial nerve number 2 that has to do with the eyesight.
Mm-hmm.
And
that makes sense, yeah.
Most people think that neuropathy is only with people that have diabetes. However, about 30% of the people that are diagnosed with peripheral neuropathy, they have diabetes. But there's another big percentage of the people out there, that 70%, that do not have diabetes and they have peripheral neuropathy, which most people don't know that, right? So there's millions of people out there right now as we speak that have peripheral neuropathy. And just like Doug was sharing with us when he first started, right? There's all the interesting part of peripheral neuropathies. People have all kinds of symptoms that can be combined. Some people will complain of electrical shocks. Some people will complain of their legs are heavy. Some people complain of intolerance to the heat. Some people will complain of numbness, tingling, pain. I mean, there's a whole list of the symptoms that people have, right? So this is kind of interesting that many times people don't really know what's going on, right? And they're like, well, what do I do? Where do I go? And they're not quite sure. So the bottom line here is there's millions of people that have it today in the United States. In the next 10 years, it's going to easily double. There's I was reviewing some paper in the medical literature just a few weeks ago with our doctors at our office. There's over 300 different drugs right now that one of the side effects is peripheral neuropathy. One that is very common, Rich, and you, Doug, you got to know about, is any of those cholesterol-reducing medication, one of the side effects is peripheral neuropathy.
Yeah.
Oh, wonderful. Thank you.
That doc said that because I'm taking a pravastatin or something like that.
That is correct.
And 40 milligrams, and they've made me take it ever since the heart surgery I had. So, and she asked me about that specifically thing that Dr. May talked about that. So,
yep.
You sound like you're on the same page here, and I'm kind of happy about that because my family has a history of diabetes, but I don't have it. Okay, as far as I know, I've never had diabetes. Although when I was younger, I had some hypoglycemic, and it seemed to go away. And I know it can flip, it can go the other way, but I've never had any issues with high blood sugar or anything like that, as far as I know. I've been tested. I get blood tests every 6 months or so for different things. But the point of it is that 70% non-diabetic thing is interesting to me because I didn't realize that at all. I thought it was all connected to diabetes or something.
But you have traumatic injuries. You could have, besides diabetes, you have infections, metabolism problems, genetics, exposure to toxins, and like you said, medications, the side effects.
Yeah,
there's also something that is in common. I want to bring this up to you guys because obviously, there's 1 million people that are diagnosed with cancer every year. 700,000 people die from cancer every year, right? But there's a lot of people that have had chemo treatment that also will develop peripheral neuropathy, which is common in people. Matter of fact, we see a lot of people post-cancer right, that are developing peripheral neuropathy. And there's also something that is really, really important, and maybe the audience is unaware of that, and maybe some of you are. But when people have peripheral neuropathy, the next thing that's going to happen is people will have issues with balance. And what you see people is you're going to see people, instead of having a normal gait, right, they're going to start shuffling. And the reason why they shuffle is they're trying to stay close to the ground so they don't fall, right? So sometimes the husband and wife come in, the husband is a little bit behind the wife, and I ask the wife, so how is your walking? And the wife would say, oh, I'm doing fine, and the husband is right behind, and he's like,
No.
right? So oftentimes people don't even recognize that this is happening to them, which is very sad, right? Obviously, it's more common as people get to be 45, 55, 65, 75.
So I was going to ask you, it is when you get a little bit older is when the symptoms generally start, or when they manifest more often than not. I mean,
Yes.
Yeah, I assume you can get it when you're younger, but generally it's older.
Yeah, because for the most part, it's a chronic illness. It's just like diabetes or heart disease. So what happens is you're going to have this development that's going to happen over time. And oftentimes people don't really realize that it's there, or when it's like, it's just like boom, when they start having symptoms and they don't know what to do about it. And unfortunately, and probably, either you guys or, our audience right now, is people go to the doctor, and from a medical standpoint, is if you have peripheral neuropathy and they diagnose you, even in the best hospital in the country, they're going to say, there is no cure. The only thing that we can do for you is we can give you medication. The medication of choice is gabapentin, Neurontin, Lyrica, right? Those are the medication that they give people for it, and to try to manage their pain. But however, they will just straight telling them, they'll be like, hey, you know what, there is no cure, and there's, you're going to have to put up with it.
That sounds wonderful, doesn't it?
But you're saying that there is a cure, or there is at least possibility
do, right?
there are things you can do to alleviate or maybe even reverse it. Is that correct?
Rich, I can look at you straight in your eyes, and the answer is yes. You know that peripheral neuropathy?
Yes.
When people qualify for a program, if I tell them that I can help them, right, I know that can be reversed. Absolutely 100%. The answer is yes to that. Right? There's a few things we're going to talk about because you've been made aware of this thing called nitric oxide.
Yeah.
But what you need to do is you need to be addressing the cause, right? So if I were to give you gabapentin for your pain, the pain might be better. However, the condition, might be continuing to get worse, which a lot of people see that, right? So you want to get to the cause of what's causing the problem, and then addressing the underlying cause, and then at the most basic level, if I were to just share that with you guys and, with the audience right now, is when people have peripheral neuropathy, they have three problems. They have a nerve problem, they have a blood flow problem, and they have an inflammation problem.
Yep. Okay.
Okay? And
Now,
then...
which is the cause? Is it the inflammation, or?
Well, those three problems are three.
They're interrelated.
The inflammation is a big part, but they're all interrelated, right? So you have the blood flow issue, and then you have the nerve disease. So you have to be going after those three things at the same time. Now, some people, they have it so bad that, you get to a point where you have so much sensory loss, the nerves in your body have the ability to feel different things, right? So if I do this to you and your eyes are closed, Rich, you should know that there's two things that are touching your leg right now.
Right.
When people have peripheral neuropathy, you do this to their leg or their feet, and they'll be like, I'm like, can you feel anything? They'll be like, no. Well, that's not normal. Because you should be able to feel that. A person can have issues with their legs, but they can also have, now the wires that are going down your legs comes from your lower back too. So, which I think you understand that. We talked about that last time, right? So there's nerves that are coming from your lower back, going down your legs and your feet, right? And sometimes when it gets to be so bad and people start having some major balance issue, what you see as well is the balance comes from the area in your brain that is in charge of controlling balance. It's called your cerebellum. So you can have multiple areas that are stacked, that are being affected, and if you don't target all of those areas as far as a strategy to reverse the process, you're going to see very minimal success.
How do you know what area to attack? Granted, you see something in the lower part of your feet and you go, okay, man, I got a problem down there. But, because I was going to ask you, would chiropractics help a little bit? Because I know sometimes the nerves can be pinched and things like that. Would that help? But how do you know where to start with? We talked about nitric oxide, or what? How do you know what to do? Where do you start? I guess.
I guess
I had to do that. I had to, this is what I do.
He's a chiropractor,
Yeah.
so we're just leading him into his...
I'm giving him softballs here, you know. That's just the way it is, you know.
I was about to just tease you, Rich, and say that's the reason why I'm the doctor and you're not, right? Just like, so how do you know? Now, this is a great question. So when we do, so I've been in practice for 20 years, right? I'm a chiropractor, but I also have a specialty in nutrition.
Correct. Yeah.
So for 20 years, I've taken care of people with neuropathy. However, to be honest with you, right, I've never claimed and telling people that I would be curing any one of those people their neuropathy. I've had some success. But for the past couple of years, we've used a program in our office that I've been able to completely getting people out of the ditch to completely reverse the process, which is absolutely wonderful.
That's revolutionary. That's like
Yes.
brand. This is the last couple of years, you say?
This is like
brand new, huh? Okay.
absolutely, you know, and there's other doctors in the country that do what we do. But what I want to share with you is, to answer your question, is how do you know how you're going to tackle the project, which is the patient? You got to find out where does the problem comes from. So number one, right, is it just the extremity? Because a person could have a problem just here. It could be that their lower back, the nerves coming out of their lower back might not be the problem. For instance, if I were to draw a number on your foot and your eyes are closed, you should be able to tell which number I'm drawing on your foot.
Right.
If you can't, that means you also have a brain problem. Right? So part of the therapy, as we're targeting, helping a person, if it was Doug or if it was you, we would have a therapy that is specifically designed based on the tests that we have done to decide we're going to do this, we're going to do this, we're going to do that, in order to tackle all the area that have issues.
So the first thing we got to realize is there's not a one size fits all. There's different reasons for neuropathy. And there may be interconnected reasons why they're having it, and that
And with Rich, it being math anxiety.
math anxiety. Yeah.
Well, so if I were to make this more specific, to give our audience and you guys to make it more specific, is think about this. If a person comes in and they tell me they're taking statin medication,
Yeah.
right? I would say, okay, let's say you, Rich. I would say, well, Rich, I want you to understand, right, that, one of the side effects of the statin medication is peripheral neuropathy, right? So what can we do to try to buffer that? I mean, if you absolutely need to take them, right? I mean, one of my goals, if you were to come to the office, or because I have a specialty in nutrition, I would do everything I could to try to reduce the amount that you need, and then maybe getting off if there's
I'd
a
love to
possibility.
get off of
You
that,
follow
yeah.
me?
Yep.
So that would be the first thing. So let's say now that you absolutely cannot do that for XYZ reason. So then the next thing is we would look up in the pharmaceutical company, they have a book. It's called the Nutrient Depletion Handbook. And what it says in that book is if you're taking those HMG-CoA reductase inhibitors, which means nothing to you, but those are the statin medication.
Okay.
So there's a big name for it, so you don't understand what that is. But in that book, you go and look it up, and it says if you're taking it, one thing that it will do is it will shut down the production of CoQ10. So then I would say, Rich, you need to start taking CoQ10 every day for the rest of your life, as long as you're taking those statin medication,
Okay.
because the statin medication will shut down the production of CoQ10.
What is CoQ10? do?
CoQ10.
I've always wondered, because I had some of that supplement for a while, but I said, what is it for?
Yeah.
I don't know.
CoQ10 is the powerhouse of the cells. That's what creates energy. And oftentimes when people start taking the statin medication and the powerhouse of the cell is not there anymore, then people start being more tired. And how the cell is functioning, it's going to be functioning at a reduced level. So then things starts breaking down. You follow me?
Yep.
So when a person is taking medication, this little book there is very handy, because you can look that up, right? And it's called the Nutrient Depletion Handbook. The pharmaceutical company puts it out there, and every medication is in that book. And for every medication a person take, there's a nutrient that it depletes your body from. So now let's say a person, they don't know a whole lot about, nutrition or anything like that. They could potentially look up their medication, and they can go in that book and they can find out which nutrients depleting their body from.
Okay.
Okay, so for you specifically, okay, today you've already, told me, you're like, I'm taking those statin medication.
Oh, yeah.
I would say, Rich, for sure right now, right, you could have neuropathy, but if we want to get you out of the ditch and start working on this, you need to take at least, 300-400 milligrams of CoQ10 every day, no question asked. That's what I would say to you. Then after that, right, our next project, what's the next project? Well, then it would be like, okay, well, let's evaluate your nutrition. Why is that? Because remember I said peripheral neuropathy is caused by 3 different things. You have a nerve problem, you have a blood flow problem, but you also have a inflammation problem.
Yeah, okay.
So you and I were on a show before that we did probably a year plus ago, right?
Yep.
And we talked a little bit about nutrition, and anything that is causing more inflammation in the body, we would want to reduce that. So anything that is sugar in nature or breaks down into sugar will cause more inflammation.
Yeah, okay.
So one of the strategy I would say, okay, Rich, one of our goals is we want to decrease the inflammation. So then we'd start evaluating, the food that you're putting into your body, and then making some improvement in that department. You're following me so far?
Yeah,
So now we went the medication route, we went the food route. Then let's say we evaluate your lower back and there's some areas of your nervous system that doesn't function properly, then we would go after that too, right? We would have a strategy to go after that. So can you see that a person with neuropathy could have multiple layers of issues, and just giving gabapentin to a person or Neurontin or Lyrica is not gonna, it's only gonna go after
No,
the
that's treating
symptom.
symptoms, yeah, it's
Right?
not treating the cause.
So if a person really want to get to the cause of the problem, right, you need to be looking at what's causing the problem.
Don't you think, this is kind of maybe a little bit far from it, but it feels to me like so much of the drug thing is about treating symptoms, not really about curing anything. And I really get irritated with some of it, it's effective, but it doesn't really, they don't talk about curing you anymore, they talk about treating you. And that,
Managing your...
yeah, that really bothers me, because in the old days, when they seemed to, quote, should have known less, they talked about curing you. They wanted to get you fixed, as opposed. Now, they acknowledge that sometimes your own body is your best weapon for that, and they can remove obstacles for that. And sometimes, okay, I'll give you an example. Okay, you take a medicine to knock a fever down, because if the fever is going to knock the germ out, but it might kill you first if it goes too high. So I understand that medicines have value for that, but it seems to be so those Lyrica and all they're doing is treating symptoms. They're not really going after the cause of anything. And it seems to be a lot of medicine is dealing with symptoms as opposed to trying to find cures for anything. And I know there's probably money involved. That probably I don't know what it is, but and of course that's the way they're teaching you. But I don't know. What do you think about that? It just bothers me when I hear I'm going to want to treat you for the pain. I want to treat you. Well, I want to be cured of this thing, So that was one thing I was kind of happy with, talking about that one doctor about the one thing, and talking to you about this neuropathy. There's actually a possibility of a cure.
Reversing the
Yeah,
process.
that's amazing. Yeah.
Well, you got to understand, Rich, every time I've been on the show with you, that's one of the things you bring up, and I don't know if you remember, but you do bring this up every time I talk to you, which you are completely 100% correct, right? That if we go to the doctor and we have a symptom, the majority of the time is we make a diagnosis, and then once we make the diagnosis, then we're looking for medication to try to knock off the symptom the person has, right? But this is what medicine is all about, for the most part. If that doesn't work, then we go to the next step, which could be surgery.
Yeah.
If we don't ask the right question, we're never going to get the right answer. The right question is what you just said was powerful. Is like, well, what's causing the problem? Now, there's something that I want to just set you straight. I don't know if I can do it on many levels, but on this particular one piece of information, I want to share this with you tonight. You talked about a fever, right? And I just want to understand, you guys, with all the shows that you've done, talking about the wisdom, that God's creation. When there's a fever, right, this is a normal response. Your body was designed for survival. So if there's a fever, that means that there's some kind of immune challenge. And the fever is designed to handle the bug. So one of the problems that we've had today in our society, if I were to ask parents at my office, tell me what a high fever is, people will be like, well, 101, 101.2, 100.5, or they even call me or they text me. And then I try to make them understand. I say, listen, if you have a bacteria or a virus or some immune challenge, some of those bugs, especially viruses, if you don't hit a certain temperature, you're never going to be able to handle the virus on it. Your body's not going to be able to handle it. So if you take a medication to try to suppress it every time, right? What happened is you never let the body handle the bug the way it should, and instead of having a problem for 24 hours and it's gone, then the problem's going to be there for days. Okay, so now let me explain a little bit more, because this is really important and it's powerful, because God did not make a mistake.
That's right.
This is a survival mechanism in order to handle the problem. So one time I had this physician come into the office, and I asked the physician, I said, I want you to tell me what a high fever is. And she says to me, well, the things that people they're thinking about seizures, they're thinking about brain damage.
Yeah.
She says, in the medical literature, we're talking about 105 or plus.
Right, that's what I would say.
So then the question remains to all of us is like, how many times in this country or in this town, with all the family that we have, that kids, when they're little, they're going to hit 106, 107, 108? It doesn't happen very often.
No.
Could it happen? The answer is yes.
Yeah.
However, we need to understand what the body's trying to do, right? So when we're talking about neuropathy, that's the exact same thing, right? Why do you have inflammation when you have neuropathy? Because when there's damage, your body uses the inflammation to heal the body,
Okay.
right? The best that it can, right? Until it loses control. So that's important to understand why does the body's trying to do that, and then getting to what's causing it. And of course, in medicine, what we know of, we're like, well, we don't know what to do with that. But we know that something could help with the pain, so we'll give you gabapentin, right? And your pain could be better, you could be sleeping better. But in the meantime, the condition is continuing to get worse. So then you have to make the choice, right? There's some patient, they're like, you know what, I just want to take the medication. And I'm like, that's fine, I'm not your guy. But if you come here and you say, hey, I want to reverse the process, is there's any hope for me? And I'm like, hey, you know what, once we evaluate you and we find out what's causing the problem, then we can make an assessment to say a plan of attack to say how can that be reversed, right? So we got to understand what's the approach and how we look at the body to say, well, if the body is just trying to adapt constantly, right? If I were to say to you tonight, Rich, if your carotid arteries would be clogged up, what would happen to your blood pressure?
It
will go up, of course, because your body's not going to let you die. It's going to push harder to get the nutrient to your brain. It's normal. It's a normal adaptation. It's called wisdom, right? And once you and I understand that, then we have a greater appreciation to understand those chronic illnesses. And then we can find a doctor that has a mind for health, not a mind for disease, but a mind for health to make the body healthier and understanding physiology, right? So then we can use strategies to be able to reverse that. And it's completely doable, right? And this is what's exciting to me, because you know what? I mean, I've been in the health business for 20 years. When people come in, they have no hope. They were told that there's no hope. Nothing can be done. You're going to take those drugs, and sometimes people don't want to take them. Sometimes people don't know that maybe there's a possibility where they might not need them.
If I can get off a statin drug, boy, you're my guy. I want to get off of that.
Yeah.
I'd love to get off of that sucker.
And when we look at God's creation and what He designed us to do, we're not like the evolutionists who believe that we are a series of chance mistakes that happened over millions of years. But we understand that God, when He made us with originally to be perfect. And because sin entered into the world, and there was things that happened.
There is that caveat. We are in a fallen world.
And
no matter how healthy we are, at some time we are appointed once to die. So there's no exemption unless the Lord.
It'd be interesting to figure out, what people did when they were living to be 969 years, like Methuselah.
That's right. That's right.
And the only reason he died is because he was a guy who was going to die before the flood,
Yeah.
But this is a difference in perspective is that the evolutionist thinks that we're all jacked out of shape because we evolved over millions of years. And we're poorly designed. Well, we believe that we were perfectly designed in the beginning. And there's just minor differences that happen because of mutations that cause us.
Well, things that are broken can be fixed.
That's right.
That's the neat thing.
And so, if we learn to discover what the Bible says about health and nutrition, and follow your Eating God's Way program, that's a way to handle this.
Well, we need to understand right? That there's no right or wrong. It's either every decision that all three of us make on a daily basis, it's either a decision that's going to be promoting more health, or it's a decision that's going to be promoting the body to break down, right? I mean, every day, it doesn't matter. And it's not right or wrong. It's just, it is what it is, right? You go to McDonald's, it's a decision that's going to be promoting more breakdown, no doubt about it, right? You eat an apple, we already know that, hey, you know what? This is a decision that's going to be promoting more health. You exercise, promoting more health. You sit on the couch, it's promoting death, right? And we know that. And again, it's not right or wrong. We got to understand, hey, you know what? We were designed to move. We were designed to eat real food. We were designed to think well. And when we don't do that, then what happens is the body will break down faster than what it should, right? And again, I just want to repeat this because this is important. It's not about feeling good or feeling bad. It's just, it is what it is, right? And it's not wrong or right. It's understanding that, right? And once a person changes the way that they think about health, then they can make better decisions. One of the things that I say, Rich, and I know this might be scary a little bit, but you know, for people, when you talk to them about diet, I don't like to talk to. I mean, who wants to be on a diet? Nobody, right? None of you here,
Right.
none of you, nobody wants to be on a diet, right? But you have to. Once you change the way you think, then our goal is to eat more food. When people come to my office and I work with them, my goal is not for them to put them on a diet. It's for me to just teach them, right, to eat more food. And if they start eating more of the good things, guess what happens to the bad things? They don't eat as much.
Well, like what kind of foods, let's say, for instance, would cut down on inflammation?
Fruits and vegetables.
Okay. I'm in the vegetables. Fruit, I don't eat as much.
Yeah,
Well, you should have
foods to
twice as
avoid.
many vegetables as you have fruit, though. So, because fruit, they also have sugar, so the sugar break down, right? So that's why you want to have twice as many vegetables as fruit.
And to avoid things like cake, cookies, handy, ice
cake,
cream,
All the stuff
bread,
you
rice,
love,
and
yeah,
pasta.
That's the problem with this, you know?
That's the stuff.
You know, it's the old thing. Are you really living longer, or you just feels like you're living longer because it takes forever because you can eat what you want to eat? You know, just kidding. But no, I mean, I had a wake up call. I've had a wake up call because I got the numbness in my toes, and I'm going, I got to think about this, and I got to start making some decisions.
Yeah.
That you know, because I've pretty willy-nilly done what I've ever wanted to do, you know, as far as any of that stuff, you know. But I wanted to talk a little bit that nitric oxide.
Nitric oxide,
What
yeah.
is that?
Nitric oxide, quickly, because I know that we're getting to the end of our show there, but nitric oxide, what it is, and when it allows the body to creates this process called vasodilation. Vasodilation is to improve the nutrient delivery to the tissue so the body can heal itself. So you can do a test, and where I think you are aware of it, you can do a test and you can find out if you have enough nitric oxide in your body. But when you don't, it's like it's a red flag because your ability to deliver, you know, nutrient to the tissue to heal are poor. Right? So when people have peripheral neuropathy, that's one of the things that they're dealing with, and that's one of the strategy nutritionally is what can you do, right, to deliver more nitric oxide in order to speed up the healing process.
Okay.
It's not the only way you can do it, but that's one of the ways that you can do it.
Yeah.
So this is Dr. Jean-Guy Daigneault, Rassel-Daigneault family chiropractic here in Lansing, a holistic health
Holistic
center.
Health Center now, yep.
And so also Gilead Healing Center and part of Mount Hope Church. And we hope you enjoyed our little talk about neuropathy today. We'll see you next time on Revolution Against Evolution.
Take care.